What's up, y'all? Welcome back to From the Ground Up. Today, I am going to be walking you through my exact framework for running workshops that not only provide real value for the attendees, but actually convert them into paying clients, all without you having to feel like an icky salesperson. So, I have found, y'all, that us clinicians, we are amazing at teaching, we are amazing at providing value and all of those lovely things, but we tend to want to, for whatever reason, avoid like selling, even when that selling is honestly the most ethical thing that we can do. And so today, like in regards to running workshops, whether it's in person or virtual workshop, doesn't matter. I want you to start thinking of workshops in this light of workshops are not the solution, right? This is not the end all be all for the people that attend the workshop. Workshops should be the setup to the solution. Okay. The real transformation for our clients, our patients, whatever that may be, should happen in your core offer. And for most of you guys listening, we're clinicians, and that's going to be, therapy services, programming, things like that. And inviting attendees, inviting people into that thing, into that core offer is not sleazy or car salesman-y, right? It's leadership, it's guidance, it's an invitation for them to actually get the help that they need. And so I want you guys to start thinking of workshops in this light of kind of being the setup to their next step with you. And how can I use this workshop to solve a problem and then invite them into, the bigger solution, if you will. And, this is something that came up. I was coaching my CEO club, which is my online coaching group for founders, specifically in pelvic health. And I was coaching them on marketing this week. And so I was like, you know what? Like, this is so applicable because someone asked about how I run workshops. And I was like, well, let me just share my entire framework on my podcast also. So you guys are about to hear it here so you can go apply it to your workshops and to your webinars and to whatever the things are that you're doing to educate the lovely public and hopefully change it from just education to, yes, we're going to provide value, but we're also going to guide them to the next step. Because like I said, like us clinicians are so dang good at educating, teaching, providing value, etc. But for some reason we lack this skill of selling, or really all that is inviting attendees to actually get our main offer, which is the thing that's going to help them anyways, right? That's what I want y'all to see. Because we can provide value in these workshops, of course we can, but we have to understand that a 1-hour workshop in a group setting is not going to heal their years of chronic symptoms, right? Our core offer, our therapy services, our coaching program, whatever it is that your main thing is that you love and that you want to do to help people, that is the thing that is going to get these people symptom-free and lasting change, right? So let's full stop, like stop trying to save the world with your workshop, okay? Use the workshop as a setup for how you're going to save the world, which is through your therapy services. And it's not icky to invite them to your therapy services or to whatever your core offer is, right? Because you believe in that thing. You love that thing. And that is the thing that is getting other clients and patients results already. So why not invite these new prospects into the thing that already is amazing and is working, right? But because I know you, because I am you, and I used to struggle with this too, I know a lot of us struggle with thinking it's sleazy or icky or a bait and switch to do this, to invite people to this free thing and then, quote unquote, turn it into a sales pitch, right? So let me break down my framework that I use in my own workshops. And this is also the framework that I teach to my team whenever they run Genesis workshops and everything. So that way you can use it too, and you can finally feel good and aligned and excited about running these workshops and also convert people to your main offer from the workshop because that's what's going to help them anyways, right? So I want to dive in first to this idea that workshops technically, are a lead magnet. And if aren't familiar with the term lead magnet, it's, in the marketing world, a lead magnet is just something, whether it's a PDF download or it's a live workshop or it's an in-person workshop or it's a 5-day free challenge. A lead magnet is just something that, well, magnetizes leads. And a lead is a potential customer to your business. Okay. And so it can look like all different ways. I used to think a lead magnet was only a downloadable PDF. Like, I don't know why I thought that, but I just did. So just hear me out when I say, like, all a lead magnet is, whether it's a PDF, live event, 5-day challenge, whatever the case may be, if you are attracting new people that have not been in like your sphere yet, or they're not on your email list yet, or whatever, they haven't heard about you yet, probably. If you are attracting these people like a magnet, if you will, if you're attracting these leads, magnetizing these leads, and you are collecting their email, this thing that you are putting on is a lead magnet. So that's, now that we got definition out of the way, like that's what a lead magnet is. The purpose now of a lead magnet is to, yes, get people on our email list, because then we're going to, have an avenue to provide them more value on our email list and share more about us or about our company or about our service or our product or our offer, whatever it is, or like whatever. So like, yes, that is helpful. But also, the purpose of the lead magnet, once they're on our email list, is to invite them to become a paying client after they've consumed your free product, your free lead magnet, right? The reason is because your main offer, your therapy services, is amazing and is helping people and will help them too. And so I'm just driving this point home because I want you to stop thinking of selling as, sleazy car salesman. Because like, if you believe in the therapy services that you're providing, that's the best thing you can offer people, is to invite them to come and see you and see your team or whatever the case may be. And so that's the purpose of a lead magnet, is to get their email so they're on your list for long-term nurturing, but also invite them after they've consumed your free thing to work with you, to your core offer, your main offer. Okay. And clinicians tend to overteach and under-invite. Okay. And it comes down to this mindset of icky selling, but I want to try and like flip it in your brain for a second to help you see that it's actually kind of our ethical responsibility to make the invitation. Because our 1-hour workshop, right, is not going to solve all their years of chronic symptoms. And so if we withhold the invitation to the thing that will, AKA our therapy services, our core offer, like, I feel like we have an ethical responsibility to be like, here's this 1-hour workshop. I am going to provide value. I am going to teach you something. And I also know I can't save the world in 1 hour, but I'm going to position this invitation and I'm going to invite you to come and work with me in my, therapy, in my brick and mortar, in my online program, whatever it is. Because that is the thing that if you opted into this workshop, right, you have this problem that this workshop is beginning to solve. And so I already know you're a quote unquote qualified lead, qualified potential patient, right? My main offer, my therapy services are what's going to get you all the way there. Your full offer, your main offer, is the full solution to the problem that you're beginning to solve with the workshop, with the lead magnet. Okay. And so that kind of brings me to the framework for the workshop. And I want to keep this like as simple for you to conceptualize and then take back truly as a framework so that you can plug in your own pizzazz and all the things and go make it your own, but just kind of utilizing this simple framework. And I kind of call it like the accordion framework. Okay. Like an accordion, the musical instrument that's like opens and closes and gets big and gets small and does that as it's playing the music, whatever. So this is kind of what I want you guys doing in the workshop. And this is what I do. This is how I run my workshops. So essentially, you want to start with the accordion big. And you want to start with the big picture of the problem that you're going to be solving. Okay. So like I'm going to give you some examples as we work through this. So it's a little bit more clear whenever I'm explaining it. So one of my team members at Genesis is going to be hosting a pelvic pain workshop next month, and it's online, virtual. And the way she's going to start it is she's going to open the accordion and kind of explain, here's all the dozens of things that can contribute to your pelvic pain, right? There's all these things. And on top of all these potential contributors, here's all these ways and these things and these interventions that we do at pelvic floor therapy to treat pelvic pain. There's all these things, right? So the accordion's wide, it's really, really big. And we're kind of like starting to show them that this is so much more than just like your pelvic pain. This is like there's so many potential causes and there's so many ways that we attack this, okay? And now this is where most of us go off the rail and we try our best to fit in an hour workshop. We try our best to teach on all of these things and to just give a little bit of a taste of all the things. I actually want you at this point to close the accordion and I want you to pick one thing. Pick one thing and you're going to go deep on it for a good amount of time. You're going to provide so much value and you're going to teach so much about this one thing. So if we're looking at her pelvic pain workshop, she's diving really, really deep into how the nervous system contributes to pelvic pain, right? So she's going to teach them what is the nervous system, how does it contribute to pelvic pain, and what is 1 to 2 things that you can start to do right now to help that. You know, like I don't know exactly what she's going to teach them, but probably like diaphragmatic breathing and maybe something in their habits of their day-to-day. I don't know. But she starts, right, with here's all these things that can cause pelvic pain. Here's all these ways that we treat it in pelvic floor therapy. For our purposes today, we're closing the accordion. For our purposes today, because I only have an hour with you, I am going to go deep on the nervous system component, and I'm going to teach you what that is, how it relates to your pelvic pain, and what you can start doing about it today, right? So there's her deep dive, and then she teaches on it. Spends a good chunk of the workshop going deep on that, teaching, giving them all the value, giving them the technique, whatever it is, feels really great about it, knocks out of the park, right? And then we're going to open the accordion back up, and we're going to go, okay, so that was the nervous system component. I explain what it is, how it relates to your pelvic pain, and what you can start doing about it now. But remember, there's all these other things that are potentially also contributing to your pelvic pain. And I gave you this one breathing exercise, but in pelvic floor therapy, remember, we do all these other things and we look at these things and we work on these things and we have these tools and we educate on these things and we have these collaborating providers that we can pull in for help, right? And so the point is kind of, sort of, to overwhelm them, but not like in a bad way. It's to show them that, yes, they took away a really helpful thing today from this workshop, and the full solution, right? The full solution is your full offer. And if they want to go deeper into it, and if they want to truly get to the root cause of their pelvic pain, let's book an eval at pelvic floor therapy, and we can walk you through the entire process and get to the root cause of your pain and actually help you overcome it and achieve true lasting change, right? And so that's the accordion framework. And it's really, really simple. Doesn't mean it's necessarily easy, but it's simple. But that's all you do is you start big, overwhelm them with all the things, close the accordion down, get very specific on one teeny tiny thing, open back the accordion, overwhelm them again. But we're not overwhelming them just to leave them overwhelmed. We are then guiding them to the solution that is our core offer, right? And so another example, that's her pelvic pain workshop that she's going to be hosting. Another example that some of you guys have maybe done with me, right, is my foot pelvic floor workshop. I hosted that 3 times this year, and it was so popular every single time. But what I do in that is at the beginning, I give an overview of my entire methodology. I'm giving just an overview of how I assess the pelvic floor, how I talk to patients, what questions am I asking, what am I looking at. Here's kind of like a list of my framework and my method, right? And so that's everything that I use to treat the pelvic floor. For today's purposes, though, we are going to zoom way in on the foot, and not only the foot, we're zooming even further into the foot to the midfoot, not even the forefoot, not the rear foot, the midfoot, right? And it's like, you're going to walk away today understanding how that midfoot contributes to pelvic floor dysfunction, especially leaking, prolapse, heaviness, pressure, hip pain, things like that. And you're going to have a couple things that you can start helping your patients with today. And then we do it. We dive deep and we go all into that midfoot, and I explain how it connects up to the pelvic floor and what it's doing and how that lack of midfoot mobility and or control, right, is playing into pelvic floor symptoms. And then I give them a couple assessments, couple interventions, and then I open back up the accordion and I'm like, but remember, there's all this other stuff that I'm also looking at because, yeah, it might be that the foot is a driver of things, but we also have to look at the ankle, and we also have to look at the big toe, and we also have to look at the tibia rotation, and we also have to look at the femur, and we also have to look at pelvis orientation, and don't forget about the rib cage, and also don't forget about the nervous system and their history and all these questions you ask. Again, like, I overwhelm them with all the things that I know to be true that I'm using in my treatment framework. And then I invite them, if they would like to learn more about my whole methodology, to take my course, right? And it's like, a lot of them do. And then I get great feedback on my course and they love it. And so it's a win-win because I feel very great about the value I provide in my foot workshop, because I know it's so helpful. Even though it's a sliver, it's one deep dive onto one tiny piece of everything, it is a very helpful teeny tiny piece of the whole picture that they can go apply and start helping their patients tomorrow with. And I feel very passionate and very confident about my course, the full solution to their assessment and treatment frameworks, right? I feel very confident that that course will change the game for them. And so I have no shame in being like, if you want it, here it is. Here's everything. Pull back the curtain, right? And so that's kind of the secret, I think, to not necessarily struggling with like feeling like a used car salesman and feeling sleazy when you're quote unquote selling, is like, still provide value in the free thing, in the lead magnet in the workshop, but also believe in your core offer so much that it's unethical not to lead them to it, right? Not to invite them to do the thing. And so hopefully that kind of accordion framework is helpful. I also, before we kind of wrap up this episode, I want to share something that has been helpful for me, is just remembering that every workshop that you host, every lead magnet you build must have a purpose. Okay. Stop randomly hosting workshops. Stop choosing random or vague topics or names for your workshop. Please just like immediately stop hosting pelvic floor 101 workshops. What even is pelvic floor 101? Who is it for? What are they struggling with? What are they going to get out of the workshop? Like, I just don't think that if we're trying to guide them to a solution, right? Like learning what the pelvic floor is not a bad thing necessarily, but that is not going to lead them to a solution. Our workshops, our lead magnets need to identify and solve one problem, but then they also need to identify or open up or illuminate 10 more problems that our core offer solves. Okay, so like pelvic floor 101 workshop, stop using that. Here's how you can choose a workshop title, or not even a title, but a topic, what you're actually going to do in your workshop or your lead magnet. You have to actually start at your main offer. You have to look at, okay, in my therapy services, in my main offer, whatever it is, what is the main problem that your core offer solves? And then we work backwards from there, right? So as an example, let's say your ideal client is prenatal postpartum women. Okay, that's your ideal client. You just absolutely love working with women during pregnancy and that first year postpartum, right? That's like your bread and butter. That's your favorite. That's what lights you up. That's what brings joy to your world, all the things. Take them, right, in your core offer and kind of imagine what is one problem that they tend to have when they see you for therapy services, right? Or one thing you help them solve, and then build a workshop around that one thing. So like if we're looking at prenatal postpartum, maybe it's lightning crotch. Okay. How many of us have moms that come during pregnancy and they have lightning crotch? Like all of us. Okay. So like do a workshop on how to help your lightning crotch or whatever. Like, my top tips for dealing with lightning crotch during pregnancy, right? That's one problem that you can and do help with in your main offer when they're seeing you for therapy. You've just pulled it out of it, and now you're going to dive deep in the workshop on that thing. Solve it for them, teach them about lightning crotch. What is it? What can they start doing today to help it? Right? And then invite them to the core offer. Invite them to come to pelvic floor therapy to see you throughout pregnancy and postpartum. And you're going to do that with that accordion framework, right? And so that's kind of what integrity in sales looks like. It is solving one problem for them for free or, a low cost, whatever. We have low cost workshops. You are solving this problem, and you're also clearly showing them how your program solves the rest of their problems and inviting them to do it, right? So just remember, when planning your workshops are not the finish line, right? They are the front door, if you will. Give value, solve one problem, illuminate more problems for them, and then invite them to your core offer, because that's what solves the rest of the problems, right? It's not sleazy to sell our main offer to people. In fact, it's quite literally the most helpful thing we can do. We want people to get in our doors, right? We are helping people. We are changing lives. Invite them to come. And when we invite them to come, it helps if we've illuminated some problems that we can help them with, right? And that's all this is doing. So if you found this framework helpful, if it kind of has helped you rethink how you're running workshops, if you're going to stop using Pelvic Floor 101 in your title and your topics, I'd love to hear about it. Please share this episode on your stories, tag me, DM me, all the things. And truthfully, give it a try. Like, when you're planning your next thing, work backwards from your core offer. What's one tiny problem that you solve for people, or one big problem? Just make it one problem, pull it out, solve it in a workshop, use the accordion framework, and then invite them to therapy with you, right? And you're going to be amazed, at how much people love the free workshop, because it is going to provide amazing value and resources and all the things. And you're going to be amazed at how many clients you get from the workshop, because you solve something for them. They're like, wow, if I got this much from a hour-long free workshop, wow, what am I really going to get when I go to therapy there, right? And it's like, they're going to get so much, and you're showing them what all they're going to get in the workshop. So hopefully that's helpful. This is the framework that I use in my own workshops. It's what I train my team on. I would love to hear your thoughts. Let me know how it works for you, and have a great rest of your day, you guys, and let's change the game.